Okay, so we were talking about how high doses of stimulants can result in some pretty bad behaviors, some things that happen, unpleasant, hard to watch. So people can get hostile, they can get paranoid, literally thinking people are out to get them, checking at the windows. Delusions, they can have false beliefs, maybe think that they can cure cancer by themselves or, some crazy false beliefs. They can be really belligerent, um, don't get along with people well, really tough to deal with. They can hurt themselves, they can hurt others. And then you can get this behavior where their skin gets really itchy and they'll scratch at it and they'll get big sores and they might worry these sores over and over. And those are called cocaine bugs. Um, all right, so what are the medical uses of stimulants? Well, as you can imagine, dilating the bronchioles for people who have asthma, this can be really helpful. To treat narcolepsy, falling asleep at inappropriate times, stimulants can be helpful with that. Really, something that makes no sense to me, but you can use stimulants to treat hyperactivity. So, what they think they do is they activate part of the brain, the frontal lobes, that allow people to focus on things and concentrate on things. Um, so that's kind of how they think they work. So methylphenidate or Ritalin are used to treat ADHD, although there are other drugs as well. Stimulants can be used to suppress appetite, make you're not really hungry when you're on a stimulant, obviously to help you stay awake. So it's been used in the armed services during wartime, like to help pilots stay awake when they have to drop bombs, things like that. And then, as I mentioned earlier, cocaine can be used as a local anesthetic, and it can be used in surgeries on the eye, ear, or nose. Now, these days, that usually doesn't happen. They usually use other drugs, but it still can be done occasionally. All right, what is speedballing? This is when cocaine is combined with heroin, and apparently the heroin kind of mellows out the really extreme feelings that the stimulants can give you. So it reduces the edginess and arousal of cocaine. That's a quote from your book. But the problem is when you don't have those aversive effects to the stimulants because they've been combined with heroin, then you might just keep using and think that you can just use more and more. And so obviously that could cause a heart attack and death. And this is how they think John Belushi, Chris Farley, and Chris Kelly died. It was because they were combining cocaine and heroin, and then they took too much cocaine. All right, what about tolerance and sensitization? So continuous cocaine administration leads to tolerance. So if someone's using um, the, the the cocaine over and over in kind of a binge, they're definitely going to develop some tolerance to those effects. Some of those effects that they do develop tolerance to are the not being hungry, also the euphoria. So once they stop, though, if they stop the cocaine for a few days, then that tolerance will kind of dissipate. If people only use cocaine intermittently, or in other words, once in a while, they can develop actually a sensitization to the motor effects and to the reinforcing effects. So if you remember, sensitization is basically the opposite of tolerance, and that's where you get more stimulated, more activated, more of whatever it is that we're talking about. So in the case of cocaine, they're actually more affected by the drug, makes them move around a lot more, and in some cases they might even get a better, higher euphoria to the drug. But people that use cocaine quite a bit usually are not using it intermittently. Usually they'll go on binges, so they'll basically use it until it's gone. And as you can imagine, this can be really dangerous. What about withdrawal? Do you suffer from withdrawal when we're talking about cocaine and amphetamines? And the answer is yes. So the physical withdrawal, kind of like when we talked about heroin, it's not life-threatening. And with cocaine especially, sometimes it's relatively mild, the physical withdrawal, okay? So it might not be obvious to someone, but the person still doesn't feel good. So there's kind of this depression or anhedonia where they can't experience pleasure, and obviously that would be kind of an opposite of what happens when the person is on the drug. They get irritable. Everybody gets irritable as a withdrawal effect from pretty much any drug. They get really tired and they try to sleep, but sometimes it's hard for them to sleep. They'll get hungry and eat a lot. So there are physical withdrawal symptoms, but they're not life-threatening, okay? But they're no fun. One thing, though, that you hear reported a lot with cocaine and amphetamines, too, is a very strong psychological withdrawal. So they will crave that drug. They will want that drug because they know if they take it, all these other things are going to go away. All right, why is stimulant use dangerous? I've already talked about this a little bit. But because that sympathetic nervous system is being activated, that can be dangerous because you could have a heart attack. So some of the extreme reactions also are dangerous because if you're paranoid or you have false beliefs or you're seeing things that aren't there, you might hurt yourself or hurt other people. And as I said, some of these reactions on people that have been on high doses of stimulants, they go into the emergency room. It's really hard to distinguish these from paranoid schizophrenia. But the big problem is that all these effects on the heart and circulatory system are really dangerous. So they might develop an aneurysm. The veins there's something that causes the clotting factors to increase, so they might have a clot, you might have hardening of the arteries. You can have sudden cardiac death, stroke, hyperthermia, so that's an increase in body temperature. Hypothermia is a decrease. So there can be a dangerous increase in body temperature. And then one thing that you see with cocaine that you don't tend to see with the other stimulant drugs is it can cause seizures. And these can kind of crop up any time. And, you could have a seizure that was serious enough that it caused death. Those cocaine bugs I talked about earlier, Lots of times people who are addicted to stimulants, whether it's cocaine, amphetamine, methamphetamine, their skin can get really bad, where they've had sores and they've picked out the sores, and it's gotten worse and worse over time. And the scientific name for that, the cocaine bugs, is formication, not to be confused with fornication, but formication. I put it on the slide there. All right, some more health effects. So as I said, cocaine and really all the stimulants affect your heart rate, and this can be dangerous if you use too much. So regular heartbeat can have complete heart failure, can have stroke, and as I mentioned with cocaine, convulsions. So approximately half of drug-related ER visits that are not alcohol-related are attributed to cocaine, amphetamine, methamphetamine. Coca-ethylene is something that your body makes if you combine cocaine and alcohol. It's a metabolite, and this has been shown to have even a more excitatory effect on blood pressure and heart rate than cocaine alone, which isn't obvious, right? You would think that the alcohol would slow that down. But for some reason, when the alcohol and cocaine are combined, it can be even more dangerous in terms of your blood pressure and heart rate. You know, kind of like when we were talking about the opiates, chronic use of stimulants, so long-term, long-time use of stimulants, seems to result in relatively few direct negative health effects. I mean, if you can keep from having a heart attack or a seizure, the effects don't seem that bad. But there is some indication that this may lead to a decreased ability to produce dopamine. And obviously, dopamine is really tied in with our pleasure system. So if you can't produce dopamine, then you're going to feel pretty bad pretty much all the time. And then also, like we talked about with the opiates, you have indirect effects from the lifestyle. So people who are, trying to get cocaine and find money for cocaine, and as soon as they have it, they use it. They're not going to be taking care of their health. They're not going to be eating properly and so on. And I already said the part about seizures. Long-term stimulant use, if a person uses these for long periods of time, they can have development of atherosclerosis, which is those fatty plaques that will constrict blood vessels, and that's also likely to lead to a heart attack. There's also some indication that there might be direct damage to the heart from a lack of oxygen. As I mentioned, they think that the dopamine system is affected, and that takes a long time to kind of come back to normal. There are several studies looking at methamphetamine users that have found that these individuals that have used methamphetamine for long periods of time seem to have some cognitive problems, especially when it comes to making decisions and memory. And it also looks like heavy amphetamine use can even affect the neurons in the brain and reduce the gray matter. The gray matter is neurons. And it almost looks like the cortex gets kind of thinned. So they do lose some brain tissue. All right, I think we're going to stop here, and I'll start this next one on another video.